Nurses are the backbone of healthcare, but Canada, like many other countries, are facing challenges due to the staffing shortages that exist. I am Dr. Venice Bryan. I am an assistant professor of nursing in the Faculty of Health Disciplines at Athabasca University. My research focuses on nursing education, particularly on the transition experiences of healthcare professionals as they move through various roles, responsibilities, and scopes of practice. Right now, we have around 86% increase in vacancy of nursing positions across Canada. We graduate around 12,500 nurses. Now, this is not enough in order to fill the gap of the amount of nurses that we need. If we are encouraging people to grow and to progress through their careers, to study up to the highest level that they are able to, then we are able to cover more gaps and we would have people being able to do more. Once people enter the healthcare workforce, say for example somebody enters as a healthcare aide, then they'll go back to school to study to become a licensed practical nurse, or LPN as we call it. And an LPN may go back to school to study to become a registered nurse or an RN, and the RN will go back to study to become a nurse practitioner. So typically we see that progression of people as they want to invest more in growing their skills and their knowledge to enable them to be better able to provide the care that the patients need, and also for career growth and progression. Why this is important to understand is that nurses in particular form the largest part of the workforce. And so if we're able to understand how it is that they transition and move through the experiences of moving from one scope of practice to the next, then we're able to inform nursing education, mentorship. This will improve patient care, ensuring that we're promoting timely, safe, quality healthcare provision to our patients. We are building on what we have learned from the pilot study that we have done here at Athabasca University, and we're expanding that to provinces, Ontario, Nova Scotia, Alberta. We're wanting to compare transition experiences of nurses across the provinces. So doing this nationally, eventually internationally, and also expanding to other health professional groups as well. We're wanting to develop this open education resource to make this publicly accessible to nurses that's moving through the different transition modes. As once we're able to provide them with this support and the resources that they need, this will be integral to helping them to practice at a high level and to provide quality, safe care to the Canadian public. So if we're able to support the people who we have in the healthcare system to be able to practice at a high level and to practice to full scope, then that will help us in providing safe, timely, quality healthcare to our patients.